it. That's it. We've got him back. Bismillahirrahmanirrahim. My name is Mohammed Arif. I'm the interim chairman of Union of Muslim Organizations. UMO is the umbrella body of Walsall mosques, and as such, we've been, for the past 3-4 weeks, we've been doing work in the community, trying to highlight the issue of vaccination, and people should be taking the vaccination. So that's
Is it just me, or has Mohammed actually frozen?
I think he has. I thought it was my connection.
Allah.
Wonders of technology, eh? You're on mute, Mohammed.
You're mute.
No, you're on mute.
So I think this was an opportunity for us to bring all the mosques together on one platform, so that we can ask questions both from an Islamic perspective and also from a GP point of view. And I'm delighted to have experts in this field. Briefly, I will introduce them. So we've got Hafiz Muhammad Saeed, who is the Imam at Aisha Mosque, Imam, who is a medical student, fourth-year medical student, and we've got Councillor Stephen Craddock, Chairman of Health and Wellbeing Board at Walsall. And we've got Dr. Adeel Riaz, who is a GP, member of British Islamic Medical Association. And I know Dr. Adeel has been doing a tremendous amount of work across Birmingham, trying to educate people on vaccination, and it particularly specialises in COVID-19. What we're going to do is I want to finish 9:30 at the latest, but ideally 9:15 if we can. Anyone wants to ask questions in English, Mirpuri, Urdu, Bengali, Arabic, then please, send your questions in through the chat box, and our experts will answer them. I'm just going to repeat that in Urdu. अगर कोई जो है उर्दू में या मीरपुरी में या बंगाली में या अरबी में जो है वो सवाल करना चाहे, तो बॉक्स जो है वो इस्तेमाल करके सवाल जो है हमें टेक्स्ट कर सकते हैं, इंशाल्लाह हमको दिया जाए. So I'm going to welcome Hafiz Muhammad Saeed to start the the program with the recitation from the Quran, and I've asked Imam Saeed to make that topical to pandemic and in particular what has gone on previously, what the Quran says pandemic. Hafiz Mohammed, Imam Masjid.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم فأرسلنا عليهم الطوفان والجراد والقمل والضفادع والدم آيات مفصلات فاستكبروا وكانوا قوما مجرمين ولما وقع عليهم الرجز قالوا يا موسى ادع لنا ربك بما عهد عندك لئن كشفت عنا الرجز لنؤمنن لك ولنرسلن معك بني إسرائيل فلما كشفنا عنهم الرجز إلى أجل هم بالغوه إذا هم ينكثون فانتقمنا منهم فأغرقناهم في اليم بأنهم كذبوا بآياتنا وكانوا عنها غافلين وقال تعالى ضرب الله مثلا قرية كانت آمنة مطمئنة يأتيها رزقها رغدا من كل مكان فكفرت بأنعم الله فأذاقها الله لباس الجوع والخوف بما كانوا يصنعون وقال ظهر الفساد في البر والبحر بما كسبت أيدي الناس ليذيقهم بعض الذي عملوا لعلهم يرجعون صدقت يا رب العالمين. Honorable guests and all the listeners, those who have joined the program, I have recited three different parts, three different places from the Quran. And all these three have very close, actually, relation, or you can say that the ayat are very relative to the matter we are discussing today. Very, you can say relevant. Allah Almighty has, revealed these ayat in also a historical background as well. The first paragraph I have recited is from Surah Al-Araf. It is actually dealing with the nation of Prophet Moses, Sayyidina Musa alayhi salatu wassalam. And Allah Almighty has started with that when the people of the nation of Sayyidina Moses, they have denied, then what has happened to them? So we sent on them the tufan, a flood, the locusts, the kummal, the frogs, and the blood, as a succession of manifest signs, ayat and bayyinat. Yet they remained arrogant, and they were of those people who were criminals. And when the punishment struck them, they said, "O Musa, O Moses, invoke your Lord for us because of his promise to you. If you remove the punishment from us, we indeed shall believe in you and shall let the children of Israel go with you." But when we removed the punishment from them for a fixed term which they had to reach, behold, they broke their word. And the other paragraph I have recited from Surah An-Nahl. It is again, Allah Almighty is giving an example of the people of a town. So and Allah gives the example of a township. It was secure and peaceful. Like we have a world and we are very peaceful, we living peacefully, we are very secure. So same was the township. Allah Almighty is giving the example and said that provision coming to it in abundance from every place. And this is basically, as I said, Quran is talking in the historical perspective. This is actually talking about the Makkah. Makkah was a hub of that time. You can say the economical hub and trading hub. So their people, the example of them is being given that the provision was coming to it in abundance from every place, but its people denied the favor of Allah. فَكَفَرَتْ بِأَنْعُمِ اللَّهِ. So Allah made, فَأَذَاقَهَا اللَّهُ لِبَاسَ الْجُوعِ وَالْخَوْفِ. So Allah made it taste extreme hunger and fear because of what they did. And same, basically, when I ponder upon these ayat, it can be extracted from these ayat that how when people, they denied the favors of Allah subhanahu wa ta'ala and the blessings of God upon us, that He has provided us security, He has provided us plenty of food and all this beautiful universe and so many things. He has blessed with all these favors. But when people, they do not actually extend their gratitude towards Him and to their Lord, then these kind of calamities afflicts the humanity. So particularly two words are very important, that libas al-ju'i wal khawf, and extreme hunger and the fear. And you can see as the result of this pandemic, the whole world is shaken. And everyone has that fear deep in his heart. And we do experience every single day. And mashallah, these, the people who are from the medical field and our honorable guests, I can see Dr. Adeel, Riaz and other doctors, they are experiencing every day that when patients, they come to them, what they're, out of their fear, what is their condition. And same is happening at their households when the people, obviously, they have a lot of fear. So this fear actually only because the people, when they get away from their Lord, from their Creator, from their provider and sustainer, the Lord Almighty. So this is actually one of the results of that denial. We need to, altogether, the humanity need to get closer to Allah subhanahu wa ta'ala. We need to recognize the rights of each other. And with the grace of Allah subhanahu wa ta'ala, we are very close with the other communities. I know that the Jewish community and the Christian community and the Hindu and the Sikh community, especially in Walsall here, we are all together. Together, we need to raise this voice, and we need to actually make people aware that how we can actually get out. Obviously, there are, the things we need to do medically, people are doing, and the government taking measures and all these, the things we are doing. But at the same time, we need some spiritual strength as well. And that spiritual strength comes through when we get closer to our Lord, our real Creator, and to Him, obviously, we are going to return. So this is that, beautiful and very vibrant message from these ayat. May Allah give us tawfiq, and may Allah, the God, enable us to act upon His advices and commandments. That's all from my side.
Hafiz Saeed Saab, Jazakallah. That's a very powerful message that calamities, as described in the Quran, the Bible, and other books of God, have happened before, and it's for us to remind ourselves that there is a bigger being in the world, and for us to work together to overcome the calamities. And God has given us brains to overcome those calamities as well. So that's quite a powerful message, Imam Saeed. Thank you very much indeed. Please Please stay with us because there'll be questions at the end. Could I now welcome Imam who is a medical student at Brighton and Sussex Medical School. Imad has been working quite closely with public health, and he's going to, for the next 5-7 minutes, he's going to talk about public health from an Islamic perspective.
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله الطاهرين ومن تبعهم بإحسان إلى يوم الدين. I'd like to welcome everyone who's attending today with Assalamu alaikum, with peace and blessings. I hope that everyone is safe and everyone is in a position where they are optimistic for the future. I know we are in terrible times at the moment with the lockdown and with everything that's going on, but I hope that everyone remains optimistic. And I think optimism is what we're here to talk about today when we're talking about the vaccine. Just to introduce myself, my name is Imad, and before I went to medical school, I classically trained as an Imam. I went to the Darul Uloom and I had a schooling in a classical Islamic education, and then I joined medical school. And I've worked with in Islamic bioethics with the likes of Dr. Asim Padala, who's one of the leading fields in Islamic. And it was actually last year, before the whole pandemic, is when I got interested in vaccinations and Islamic perspective on vaccinations, and I actually wrote a paper whilst I was doing an internship at the University of Chicago on vaccinations, and this was in particular childhood vaccinations. And since then, I've worked on the British Islamic Medical Association health promotion team, and we've been working on Operation Vaccination, which is getting people vaccinated even before the pandemic, which was the other sort of vaccinations. So the fears regarding vaccinations have always existed, and they will continue to exist. And it's kind of a natural thing that if you are having a medication when you apparently are not ill, people are right. It's their right to be skeptical. It's their right to be skeptical of something that you haven't experienced before. And during the beginning of this pandemic, and when the talk of vaccinations was going about, and there was a race of vaccinations, and the three companies, Pfizer, Moderna, and the Oxford AstraZeneca vaccine, they all kind of raced and they brought out the vaccine. People were a bit confused as to how on earth was this vaccine produced in such a short amount of time. And this was a common kind of misconception amongst people. And then there were loads of kind of WhatsApp messages being spread about. There were videos being spread about. And then on the internet, we see, some responses being kind of given by, alhamdulillah, by Muslim scholars. And, there are, I can't sort of go through every single misconception. And I'm sure, there are people here, alhamdulillah, some doctors here who are going to speak on the individual misconceptions that people have and the scientific misconceptions. But what I really wanted to bring about is we need to realize as Muslims that our rights extend to those who are around us as well. In Islam, people ask, the first thing they ask a scholar is it permissible or is it impermissible for me to have this vaccine? And this is the first question that people ask Islamic scholars, and they will ask their local Imam, they will ask their local Mufti and religious leader, that am I sort of going against my faith by taking this vaccine? And the overwhelming response by the Imams, and it was kind of a result of loads of the Imams coming together with this new sort of unprecedented kind of thing with widespread vaccinations, and they came together and they agreed upon the permissibility of vaccines. However, the second kind of question that people have is, if my religion allows it, should I be taking the vaccine? And I think this is the main question people have, that what does Islam say about it? And the truth is that Islam has not specifically mentioned the word vaccine because vaccine is something unprecedented. It's not mentioned in scripture. However, the values that our scripture teaches us, the values of altruism, the values of helping one another, the values of having our rights extend upon one another, this is what our religion teaches us. So we can extrapolate these values and place them on the situation we are in today. And by this, we can understand that Islam actually encourages us to kind of consider the health of those around us as well. So even though we might be young, fit and healthy, and if we are offered the vaccine, and you might think, okay, I'm not going to get really ill from COVID-19, so why should I take the vaccine? The answer to that would be, you know, to protect those who are around you, to protect those vulnerable people who are around you. And, you know, and people, you know, and now, and we're seeing more and more messages being spread about, look, the people who have taken the vaccine, they've gotten ill. Some people have been taking the vaccine and, you know, they've died a few days after taking the vaccine. And even though the death has got nothing to do with COVID-19, people are still mentioning this. All of these crazy, unspurious correlations. And what's really kind of important to note is a correlation does not equate to a causation. If something happens and it happens at the same time as something else, it doesn't mean that it caused that. And a classic example that I wrote in the paper last year was there was a study on the amount of films that Nicolas Cage appeared in over a 10-year period and the amount of people who died by drowning. There was a positive correlation there. But no one in their right mind would think because Nicolas Cage appeared in a film, people are then dying by drowning. That's got nothing to do. But there is a positive correlation if we look at it, and if we kind of align these values, this is what's present in the data. So there will be loads of things that we'll see and it will be picked up, but it has to be ratified by, you know, a medical body. And no one's saying you can't be skeptical. You need to do your research because it's something that will, you know, affect you. It will affect your families. So maybe look into it. And another question I had before this talk, when we were sending the messages out for the talk, and you know, people were sending messages in before, and I hope people will have the opportunity to kind of have ask questions at the end. But people were saying, okay, on this kind of platform, there are doctors, and you know, there are Islamic scholars, and you know, other such individuals who are, you know, concerned with public health. However, you know, why isn't there someone who's worked on the vaccine? Why can't they tell us the inside information? And the reality is people are not having those objections. People are having the objections of kind of the morality of taking the vaccine or not taking the vaccine. And the science behind it, it's not really a layman's field. I mean, if someone is interested in that, by all means, there is so much data. There are, you know, specialists, immunologists and vaccinologists who are working on the vaccine and, you know, the biotechnology regarding the vaccine. But the question isn't regarding that. And this is not the question that the public is asking. The question that the public is asking is regarding safety and regarding the data. How quickly is this? Why is this vaccine? Why has it taken just a year to produce, whilst we have so many other diseases, and it's taken, you know, in the past that have required vaccines, and these diseases have it's taken years for vaccines to be produced, and these are kind of the main misconceptions. And myself, I think, you know, I've been on a few of these kind of platforms where, you know, I've advised people regarding the vaccine, and it seems kind of, you know, I'm repeating things, but for some people it is new information. People need to know the answers regarding this. And it's okay to kind of know the answers regarding this and to seek the answers regarding this. So I think my main message is whenever we have information that's given to us, I think we need to first verify the authenticity of that information, you know, regarding deaths, regarding side effects, because of course there will be side effects from the vaccines. But these side effects, you know, the severity of these side effects, some studies have exaggerated them, and some people are truly exaggerating them and taking things out of context. People who do not have training in the reading of scientific papers, they are kind of extracting information from scientific papers without truly understanding how to draw conclusions from data. And this is a real reason why people have this vaccine hesitancy at the moment. Loads of people are on, you know, maybe everyone's not being offered the vaccine at the moment, but soon people will start, everyone will be offered the vaccine. And at this time, you know, it's important that we're not telling everyone, you know, you have to take the vaccine. It's your decision to take the vaccine. However, we're telling everyone, and this is the main message, to consider the rights of others that are upon us when deciding whether or not to take the vaccine. And this is kind of the main message I wanted to get across today, and you know what I was speaking about with the organizers. And I think, you know, regarding the misconceptions about the vaccine, I think depending on the audience, I think it would be best if we have like an audience-based kind of questions regarding this at the end. I'm not sure if we've already mentioned that. Chairman, have we mentioned this?
Imad, that's great. Thanks very much for keeping to the time. Yes, we have a question answer session at the end. There are people who are joining the chat. I'm sure you can see messages. So please feel free to ask questions in the chat room. Couple of comments that have been made. I welcome those comments. And of course, people are mentioning that in the Quran, it mentions the disease, but also it gives a cure as well. So I'm sure we'll have those questions asked. It's my great pleasure to introduce and welcome Councillor Stephen Craddock, who is the chairman of Walsall Council, Walsall Council's Health and Wellbeing Board. And Stephen Craddock is a councillor for Brownhills. And if you've been reading the press, he's been doing tremendous amounts of work trying to get a message through to the community to take vaccination. I guess, Stephen, the SAGE group that hasn't really done us any favors, because the research that they carried out showed us that 72% of the BAME community is unlikely or very unlikely to take up the vaccination. And then, of course, it goes on to say that the Pakistani Bangladeshi community is 43% unlikely to take the vaccination. But that was back in October. But I welcome you to the program, Stephen, and thanks very much for joining us. I know you've got a busy schedule, so I'll hand over to you for the next 7 to 10 minutes to talk us through the work and the message that you want to get across.
Thanks, Mo. I appreciate that. And thank you very much for the invitation to your meeting. As you said, I'm Councillor Stephen Craddock. I'm the Cabinet Member responsible for health and wellbeing at the Council. There can't be anybody here who hasn't been affected by this awful virus. One of my councillor colleagues lost his father before Christmas, and since then he's lost his wife and his mother in the last 4 weeks to COVID. I've lost 2 close friends to COVID, and another took his own life because he couldn't cope with the loneliness and isolation that this dreadful virus has created. Fortunately, we have a way out of this dreadful situation with the approval of 2 vaccines so far. I know there's more to come. The Council have been working with the NHS and other partners to roll out the mass vaccination programme in Walsall. We started in December with the Pfizer vaccine, and that had to be stored at a very low temperature. Only a few places were able to physically cope with the storage requirements. So most of the first vaccinations were distributed by the Manor Hospital and 1 or 2 healthcare centres. The second vaccine, which you'll have heard about, is the Oxford AstraZeneca vaccine. This is much easier to store. All you need is a fridge. And this has meant we can start the vaccinations across the borough. We have a number of sites already operational, and today we've opened our largest site at the old TJ Hughes shop in the Sadler Centre. And when that is fully operational, we should be able to do about 6,000 tests just from there alone per day. We're all suffering from lockdown fatigue, but there is one way that we can get back to normal, and that's for many people, and that is for as many people as possible to have the vaccination, and I'll come back to that later. I'm sure the doctors will talk about this more, but the vaccine does 2 things. For around 70 to 80% of people, it stops them getting the infection. It stimulates the body to produce a natural defence to the virus. And more importantly, for anyone that does get COVID, it prevents you getting a serious illness, and it clearly saves lives. We've had some fantastic news today about the AstraZeneca vaccine. Not only is it very effective, but it prevents you passing the virus to other people. And also the government strategy of spacing the second dose of the vaccine out to 3 months improves the effectiveness and the duration of the immune response. So let's talk about the vaccine. It's safe. The approval process was fast and given priority, but there were no shortcuts where the safety of the vaccine is concerned. So far, we've done about 10 million vaccinations in the UK, and we've, as far as I'm aware, we've had no serious side effects that have been reported. In Walsall, I don't know the exact figure, but it's over 300,000. And so far, as of last week, we'd had 6 people who'd had a very minor reaction to the vaccination, and none of those needed treatment. The vaccine has been approved by all faith groups as being acceptable. It doesn't contain anything that would compromise your religious beliefs. I'm pleased to say that both of my parents have had their vaccinations. I'm in the next group to be called, so I'm hoping to have mine in around a fortnight's time. Your GP practices will call you or text you when it's your turn, and we're hoping that all of the first doses can be done by the end of March. So that's less than 8 weeks away. And then we can start getting started on the second dose. Please accept the invitation and get your vaccinations. I can't stress how important this is. The BAME community in general have been adversely affected by the virus, so it's really important that we get nearly everyone protected as soon as possible. One final thing, when you've had the vaccine, it's not a party pass to go back to mixing and socialising with other people. We need everybody to be vaccinated before we can get back to some sort of normal life. I haven't talked about the South African variant or the mass testing that's taking place in WS2, but I'm happy to take questions on that or any other questions you have. And it's interesting, I just scribbled down, you'll know, and moms particularly probably, the normal vaccinations take for diphtheria, tetanus, whooping cough, polio, measles, mumps, rubella, chickenpox, hepatitis. I suspect the majority of the people on the call have already had a number of vaccinations in their life. This is one more. It will change over time. The virus will mutate, and we are likely to need, whether it's annual or biannual or every 2 years, we will need a vaccination as well to cope with the new variant. But I can't stress how important it is that you take the vaccination. Thank you, Chair. I'm happy to take questions.
Yeah, thanks very much, Cabinet Member Stephen Craddock. It's much appreciated. We will invite people to ask questions in the forum once Dr. Adeel has said few things. But I just wanted to add, Stephen, that we've had something like 600 deaths in Walsall Manor, around 140 in care homes, and roughly the Muslim representation is fairly well represented there, unfortunately. Having dealt with many deaths, I would say that in Walsall we have lost around about 90 to 100 people that most of us would probably know them by face or by their name. So we are, in terms of the devastating impact on the Walsall community, the BAME community is well represented, and particularly the Muslim community. I'm sure Dr. Adeel can talk from a Birmingham and Sandwell perspective as well. But it's I'd like to now welcome Dr. Adeel Riaz, who is a GP in Sandwell and Birmingham. Adeel is a member of BEMA, which is the British Islamic Medical Association, and he's been doing tremendous amounts of voluntary work in the Muslim community across Birmingham in various languages, working with a cabinet member for Birmingham, Wasim Zafar, and other people, trying to send out a message to the Muslim community to take vaccination and, answering questions. So great pleasure to welcome Dr. Adeel Riaz. Adeel, can you hear us?
Can you unmute yourself?
Adeel, can you hear us?
I can hear you.
Okay.
You're very faint.
Very faint.
We're in your hands, Adeel. Are you getting the presentation ready?
Yes. Can you hear me now?
Just about.
Just about. Sorry.
Adeel, can you move a little bit closer to the phone or to the computer?
Can you hear me now?
Yeah, clear, loud and clear.
Wonderful. Sorry for that. Now, if you could tell me if you could see my presentation. Can you see that?
Not yet.
Not yet. Sorry for this.
It was on the screen earlier, and you were trying to put it on presentation.
Okay, I'll share it again now.
Yes, if you can put it on on the presentation mode, then that'd be great.
Yeah, I'll do that. Sorry for this. Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. My name is Adeel Riaz. I work in Birmingham in Covid-19 clinic. I've been doing that since the start of the pandemic. I am a Walsall resident, so that's my interest with the place. I'm also a member of British Islamic Medical Association, and in that capacity as well, I'm talking to you today. So BIMA has got 4,000 plus healthcare professionals in its membership, and it is one of the largest Islamic body in medical profession here in UK. We do various activities. So I'll keep the presentation short to 10 minutes, I've been told, because we want to keep some question answer sessions at the end. So we'll go straight to the point that COVID is real. It's amazing that it's been like since February, March, we are in the pandemic and we see people on daily basis who still believe that COVID is not real or the figures are all made up. So I'm sure most of you would know someone who's been to hospital. Manor Hospital is up to the capacity at the moment. People having oxygen, positive ventilation, ventilators. Some of you who are in the audience today probably have already been to either of these things, or you know someone who's been to hospital. So this slide, which I've got at the bottom, it's the most recent one with after the new variant, and we see sudden increase in the intensive care admission. And the thing to note is that the age of the patient is getting younger and younger, which are being admitted, and average age at the moment is 60. And if you talk about ethnic minority, the average age is 58 for the intensive care admissions. So COVID is real, and numbers don't lie. There's something which we hear quite often, and today's talk, obviously, I'll be, because it's focused on vaccination, and people who talk against vaccination or who do not propagate vaccination, they would say that the deaths happen anyway in the winters and the people die with flu as well. So these graphs are quite stark reminder. So in UK, up to 4 million people, these figures are from yesterday actually, 4 million people had COVID so far, and 107,000 people have died. And total deaths worldwide were 2.24 million. So this time last year, in February, we had 230 deaths. So it's 2.24 million, which is very careful estimate because most of the places, the developing countries, the data collection is not as accurate. But if you look at these graphs on the right, the dotted line is the 5-year average, and you would see the peaks which we've been having due to the COVID. So it's definitely not like a normal winter season. And the one at the bottom is quite interesting. The dark blue color is the COVID deaths, and the green are the normal deaths, which happen anyway. And the dotted line is the 5-year average. And you would see we're way above the 5-year average in all of these lines. And the interesting one now in January is that the normal deaths before COVID actually have reduced. So the non-COVID deaths have actually reduced. And the main reason behind that is most likely lockdown. In my regular practice as a GP, this time of the year, normally we're inundated with seasonal flus. And thankfully, because of the lockdowns, we are not seeing that much of the seasonal flu. But obviously, COVID deaths have significantly raised the bar, and we are way above the seasonal average. So these are all the data from ONS. And the average death toll at the moment is higher than we have ever known, probably since the World War times. And these are another graph. The idea to show these tables is basically just to remind you that COVID is out there. It is real. And these both male and female, it would show you that there's 100% increase in the death rates in the people above the age of 65. There's 78% or 66% death rate increase in younger people. So it is definitely affecting lots of people. And the way which I often tell people is that over last 30 to 40 days, it's basically happening is that we are having 2 A380 Airbuses colliding on the skies of Brighton every day. So A380 is the biggest airline known to us, which has a capacity of up to 700 to 800 people. So 2 of them are colliding, and these are excess deaths, which would not have happened before the pandemic. Just to briefly talk about this new variant, so some of my colleagues in BIMA have worked on this. So if, and this is easy for all of you to know the difference between the old variant and the new variant. And by the way, mutations are no surprise for us. Mutations in viruses happen. Coronavirus mutations, the coronaviruses that have been there before have been mutating as well. But because the virus which is going around at the moment, people do not have immunity to it, that's why it's causing more damage. So if 10,000 people had COVID-19 with the previous version, after 1 month of the spread, 129 would die. But with the new variant, which we're talking about the Kent UK variant, they say it's about 70% more transmissible. But even if it's 50% more transmissible, if 10,000 people would get it, after 1 month, 978 people would die. So it's not that it's more dangerous. There are some studies that's probably more dangerous, but the reason more people are dying is because it's spreading much faster. So that's why you've seen a sudden steep curve in the deaths. But obviously, these could be prevented if we slow down the spread of the virus. And Imam Saeed was there before. We've seen in all the local masajid the funeral prayers, and it's happening everywhere. So there's hardly a day we don't get a message on our social media that someone has passed away in our street, in our area where we live, in cities back home. In last 1 year, so many of us have lost so many loved ones. So if someone still says that COVID is not real or the numbers are made up, they need to think again and look harder. And like Councillor Craddock said, that the way out of this, thankfully, we are fortunate to be in the country where we've got access to these vaccinations. So vaccination is prevention. It's not the cure of COVID. So in spite of all the experience we've got with this virus over the last 1 year, we still do not have a specific cure which would say, oh, take this and you'll be fine. So prevention is still better. And vaccinations have shown us a way out of this crashing plan. I'm not going to go too much into the science, but Pfizer and AstraZeneca are 2 vaccines being administered. It's important to know that you're not going to get the choice. So when you get the invitation to get the vaccination, you go and get it. Both of them are good. Both of them are approved. I had Pfizer. Lots of my colleagues had AstraZeneca. However, if you suffer from severe allergic reactions, if you carry an EpiPen, then Pfizer is not for you. But normal routine allergic reactions, Pfizer is fine. or if you're housebound, then again, Pfizer is not for you because of the temperature control measures. BIMA has done extensive statements on these vaccinations after consulting the scholars and the virologists and all the infectious disease specialists and quite a few Muslims who are in the pharmaceutical industry. So we've spoken to all of them and we've done these statements which are on our website. Most of you probably would have seen this grid by now. Most of the areas are in category 4 and 5 at the moment. Some are still doing 2 or 3, but the first 9 or 10 we are hoping would be covered by April. So if you fall in any of these categories, you'll be getting a call soon. So we are fortunate the UK is in the top of the list. 10 million figure. I actually made this slide yesterday. So today 10 million has been hit. So 10 million people have been vaccinated. And if you see the list of the other countries, they're all rich countries. So we should be grateful that we are in the place where we've got access. But unfortunately, in the developing world, people don't have access. There's only 1.3% of the population of the world has been vaccinated. And obviously for us who are immigrants or second or third generation living in this country, we'll be going back home and we're hoping people all over the world will be able to get vaccinated so that we could we could enjoy the normal life again. So there are plenty of obviously myths which we regularly hear about this, but there are few I just want to quickly point to before I finish my presentation. COVID is more dangerous than flu, 10 times more dangerous than flu. So deaths are definitely not being exaggerated. If anything, they're being underreported. Pharmaceutical companies, well, they're no sense. The industry have done some unethical things in the past, but that does not mean that we wipe out everything we do. Most of us, I mean, I prescribe pharmaceutical made medicines all the time. Most of you would take those medicines and your family members take these medicines. So the pharmaceutical companies do a lot of good. My colleagues have touched on these things before. We had 10 million vaccinations, 4 million people had COVID and 107,000 died. 10 million had vaccination, no one has died, let alone died. No one has been admitted in hospital due to the serious side effects. So there's no comparison. So there are more and more of these, obviously, conspiracy theories. They're all available on BIMA website, which is britishima.org. But the important thing which I wanted to pass on today, that COVID-19 is a killer. Do not underestimate it. But when the information comes to you, please go to your trusted sources, go to your doctors, speak to the doctors in your community who you trust, nurses or other allied health professionals, or imams in your community. Speak to them. At the end of the day, it is your choice, but please do make an informed choice. Thank you very much.
Dr. Adeel, Riaz, thanks very much indeed. That's quite an eye-opener for most of us in terms of number of deaths that have happened and how serious the new variant is. So that obviously people are making comments that those that have joined us, there's a number of some of them have lost family members and close friends. So the message that Dr. Adeel Riaz has passed does strike home. And the good news is 10 million vaccinations so far, and no one's been admitted for coronavirus or died from it. So that's excellent news. We now have a panel. I can see Councillor Craddock, I can see Dr. Adeel, I can Imam is still there. I'm not sure what Imam, yeah, Imam Saeed is still here. So number of questions are in as well, but I want there are about 45 odd people watching and listening. Can I open up the panel to questions, please? Urdu, Mirpuri, Bengali. Imad, do you understand Bengali or?
Yes, I can.
Okay. Can I open up to questions, please?
Chair, I saw one on there that was asking how long does it take the COVID vaccination to take effect. I will defer to the doctor here to give that on. My understanding is 2 to 3 weeks, but I'd much rather he answered it.
Yeah, you're right. Most of the studies during the trial, we know that after the first vaccine, it takes 2 weeks for your body to develop antibodies. However, the data varies that after first injection, you may have up to 50% of the defense against the disease. So you're not out of the woods completely after the first injection, but it takes 2 weeks to develop some immunity. But obviously, once you have the second injection, which is going to be 12 weeks after the first one, then you're likely to develop 80 to 90% immunity to get the COVID-19 disease. However, the data is quite remarkable that up to 100% immunity to the serious life-threatening COVID. So, and it's important to differentiate between the two things. There's something about getting virus. You would still get the virus even if you get vaccinated, but you would not get COVID-19 disease, hopefully. So if you get the virus, you're likely to spread it and give it to other people who are not vaccinated. So that's why it's important until everyone gets vaccinated, or more than 70% of the people get vaccinated, then we come out of these social distancing measures. But to answer your question, yes, after 2 weeks, you start developing some immunity. After 2 injections, you are in much safer place.
Chair, there's another question come up there about people who are under 50, under 30 and the like. The doctor put up a chart earlier on. I'm not sure if you can, it's the, I'm afraid the background takes it out. It's the ladder chart which you put up earlier, doctor, which gives a clear indication of when people will get the vaccination. And at the bottom of the ladder, it says rest of the population. So it will do those categories first. But there in Walsall, we're really steaming ahead. We're kind of leading the field regionally, and we're well up in terms of the national targets. So we're really trying hard to get all of the vaccinations done by the end of March. So that's only 6-7 weeks to go before all of them are done, including the age groups under 50. And then we'll be going on to the second round of the second dose of the vaccine. So within another 3 months, everybody should have had the 2 doses. So we're moving very fast in Walsall. I'm very proud of the progress we've made.
Steve, do you want to just share with people that are listening and watching in terms of the vaccination centres? There are, to my knowledge, 4 or 5 operating nationally, throughout Walsall, and the new ones being set up. Perhaps you can just comment on those so people know where they are.
I can't list them all because I can't remember them all, to be honest, Chair. I've got, obviously we've got one at Bloxwich Active Living Centre, there's one at Oak Park, there's a number of GP practices which are, and healthcare centres which are distributing. But the big announcement today, so it's hot off the press, is that the old TJ Hughes, and somebody's just put it on the thread, the TJ Hughes in the centre of the Sadler's Centre has opened today. And that will be able to do 6,000 vaccinations per day. So that's really going to ramp up our capacity. We should have over 10,000, providing we can get the supply, and that's a little bit of a caveat. We should be able to do 10,000 vaccinations per day.
Thank you. That's what I was trying to do, share the big announcement of the opening of a vaccination centre at Sadler's Centre. So thank you very much for sharing that. Can I open it up to questions again, please, either in the chat room, or if anyone wishes to raise their hands, then we can invite you to ask a question. उर्दू में अगर कोई सवाल जो है वो करना चाहें तो डॉक्टर अदील रियाज उर्दू समझते हैं, हाफिज और इमाम, तो उर्दू में भी अगर कोई सवाल करना चाहें मीर में, तो सवाल जो है वो कर सकते हैं.
एक सवाल मैं आरिफ साहब इजाजत है मुझे?
जी कैरी ऑन मौलाना।
डॉक्टर अदील रियाज से मैं ये सवाल करना चाहूंगा। मैं समझता हूँ कि इससे ज़ाहिर है जो दूसरे लोग सुन रहे हैं उन तक भी बात पहुंच जाएगी। मैं ये पूछना चाहता हूँ कि ये जो कोविड की वजह से ज्यादा सीरियस पेशेंट आते हैं जिन्हें फिर आईसीयू में ले जाना पड़ता है, यानी ऑक्सीजन लो होती है और उस लेवल उनका, तो क्या उन्हें उस मौके पर वैक्सीन देकर कोई यानी फायदा होता है कि वो बैक टू नॉर्मल अपना यानी वो रेजिस्ट कर सके उनकी बॉडी अगेंस्ट द वायरस? यानी ऐसा जी
जी
Adeel, can I just
जी
stop you? Can I just
sure.
repeat that question in English so
Sure.
that
Thank you.
people understand what question's being asked? So Imam Saeed has asked the question that those people that are serious in Walsall Manor with COVID, could they be given the vaccination to save their lives? Is that right, Adeel? That's what I understand the question to be.
Yeah, that's right. That's the question. असल में अच्छा क्वेश्चन है आपका, लेकिन ये वैक्सीन है ये प्रिवेंशन है, आपको कोविड-19 होने से रोकने के लिए है, क्योंकि ये आपके जिस्म में डिफेंस पैदा करती है कि जब आपको कोविड-19 की इन्फेक्शन लगे तो वायरस को रिकग्नाइज करके आपको कोविड-19 बीमारी नहीं होने दे। लेकिन जब आपको बीमारी हो गई है तो फिर वैक्सीन का काम नहीं है, फिर तो आपको और इलाज चाहिए। सो वैक्सीन का ये है कि बीमारी होने से आपको रोकेगी, बीमारी का इलाज नहीं करेगी। बल्कि इस तरह के मरीज को जिसको पहले से ही कोविड-19 हुआ है और वो सीरियस बीमार है, वैक्सीन लगाने का उसको फायदा नहीं, क्योंकि जिस्म में इतनी इम्यूनिटी है। बल्कि गवर्नमेंट की गाइडलाइन, अभी जो रिसर्च पे गाइडलाइन ये है कि अगर आपको कोविड-19 हो गया है, उसके बाद आप 4 हफ्ते वेट करेंगे आपको वैक्सीन लगवाने के लिए, यानी आपके टेस्ट पॉजिटिव आने के 4 वीक्स बाद आप वैक्सीन लगा सकते हैं। So just to simply say that the question, Arif Sahab have said the question, so that basically there's no point giving the vaccine if you already have or positive with COVID. Admitted in ITU, obviously, surely no vaccines are for you. Vaccines are to prevent you getting to the intensive care. Once you are there are other treatments you need. So if you're tested positive for COVID, after 4 weeks of you testing positive for COVID, you are eligible to get the vaccine again after 4 weeks. So there need to be a 4-week gap between you testing positive and then getting COVID. The people who are, so unfortunately, it's not a magic cure. It's a prevention for us not to get COVID.
Yeah, it would be useful. I mean, Dr. Adeel will know this better than I, but actually, over the last 8 to 9 months, the treatments in hospital have changed dramatically, and actually, your chances of surviving COVID in hospital are much better, although it's still a very, very serious illness. So there has been better treatments in intensive care, but they don't stop everybody from dying, unfortunately.
Yes.
Any more questions? Some more people have joined us. We're opening up the panel to questions either in Urdu, Mirpuri, Punjabi, Arabic. So I'll invite some more questions.
There is a question.
Arif, question for me, Dr. Adeel sir.
Is that? I think that's former councillor Yasin. I can recognize the voice. Is that Yasin?
Yeah. Basically, Dr. Adeel mentioned 12 weeks, the gaps between the 2 doses. But in the presses, in the BBC and the Sky News, when these vaccinations was announced, and they were saying the Pfizer was 3 weeks sort of interval sort of thing, and then the government said 12 weeks. And people are still sort of saying that 12 weeks is a bigger gap for Pfizer wise, and try to bring it for 6 weeks. What's your thoughts about that?
Yeah, it's a good question. You're right. In the trials for both of these vaccines, the second dose, the booster, was given after 3 weeks. The decision, the way the government, obviously their decision is based on the scientific advice. So they had 2 options. One option was because obviously we've got, ideally everyone should get in 3 weeks, but we are not in ideal world. There's a limited supply of vaccine coming. So they had 2 options. One option was to give it to the ultra high risk group, people above 80s or 90s, or people who were seriously unwell, give them both both dosages 3 weeks apart. But that would not stop the spread of the virus. So they made the choice which is evidence based, that we give 12 weeks gap, but we try to give as many people as possible the first injection, so that at least some immunity is developed. Now, this investigation, this is evidence-based, because when they do the trials, they keep on checking your antibody levels after frequent intervals, and there are plenty of studies out there that you still retain a reasonable amount of antibodies in your body after 12 weeks. So it's better to give first injection to all our loved ones and most people in the community, rather than prioritizing few and they get more and some get nothing. So I had the Pfizer vaccine almost 5 weeks ago. Although we have access to vaccines, we give it to the patients, but we're not getting it. So everyone is in the same boat, and it's a fair way to deal with this thing. And I think when the supplies are excessive, then probably this time period will be shortened. But at the moment, medical evidence suggests that 12 weeks is reasonable.
Thank you, Dr. Adeel. There's a question on the chat room with regards to minimum age for children for vaccination, but I'd let the doctor answer that question, and perhaps if Steve wants to come in, by all means. So minimum age for children to be vaccinated.
So there are two broad groups of people who this vaccine at the moment is not licensed for. One is children below 18, and other are pregnant ladies. And the reason it's not is because they are not part of the trials, and not just for vaccine. For any medicines, children and especially pregnant ladies are not part of the trials for ethical reason. So the children, there are two things. Firstly, yes, they were not in the part of the trial. Secondly, thankfully, this is probably the silver lining. We've noticed that COVID, children do spread, but it doesn't affect them as much. So if we're able to immunize most of the adults, then we are fine. So children, there's probably not a clinical need as well, unless your child suffers from significant medical issues and they've got multiple medical problems. Then it will be case by case decision, and please discuss with your own doctor, and they would give you advice. These are not the forums for that. And for pregnant ladies, the same rule applies. It's not for pregnant ladies at the moment because of the trials not done. However, if there is a pregnant lady who suffers from other medical illnesses, they need to discuss with the doctor. It is upon the discretion of the doctor to recommend the vaccines to them. So the minimum age is 18 at the moment. However, things change in the future. At the moment, it's 18.
Okay, thank you. Steve, do you want to add anything to that?
The doctor has covered it very well. The one thing I've just seen on the chat room is that, why do people say it's got fetuses in the vaccine? I don't know why people say that, because it's complete tosh. It's nonsense. It's not true. And yeah. I'm sure the doctor could confirm that.
The way these anti-vaxxer things work is that they mix the partial truth with the lie. So that's how you confuse the people. There is some truth in this. So what basically happens, and it doesn't apply to Pfizer and Moderna, but AstraZeneca vaccine, it's one of those vaccines where, so what basically during the vaccine development phase, and I wrote to AstraZeneca and I got the direct answer from them about this. So firstly, I agree that the vaccine, the vial that goes in your arm does not have any fetal cells. However, there is an ethical issue here that during the vaccine development process, they do use aborted fetal cells. But the important things for you to understand is that these were the fetuses that got aborted in 70s. And at that time, they took the cells. For AstraZeneca, the cells were taken from the kidney cells. But now then the second generation, third generation, fourth generations of those cells. So the cells which they use now have nothing to do with the actual fetuses that were aborted in 60s or 70s. At that time, they didn't have technology. Now the technology has changed. So these fetal cells are just used to grow certain viruses for research purposes. When you develop the actual vaccine, there are no fetal cells there. There are no animal cells there. They are suitable for vegetarian as well. So people who send these anti-vaxxer or confusion message, they actually take this part of the information from some literature, they modify it, and then they pass it to the masses. Someone the other day in one of the webinars mentioned to me that, oh, there's a chimp adenovirus mentioned in AstraZeneca ingredients. So it has got chimp cells. So then I explained to them that this is the adenovirus that affects chimps. so it doesn't affect humans. So they take that virus and use it as a vector to, so there's no chimp cells there. But this is how people use the information. So just trust your professional people that there are no fetal cells in these.
Thank you, Dr. Riaz. Just extending the question to what you touched upon, fertility issues for young sisters. There is some reluctance amongst a younger group of sisters, women, who think that by having the vaccination, it might cause them fertility problems in the future. Have you come across that issue?
It is a good question, and actually this is one of the most recent conspiracy theory that started. And again, it's based on partial truth. There was an epidemiologist in Germany who few months back wrote a study that there's an enzyme that might get secreted because of these vaccinations, and that can affect the fertility. However, obviously, when the vaccinations went through the trial, that enzyme was not secreted, and that epidemiologist himself retracted his statement that no, it doesn't have any effect to the fertility. However, people who have a specific agendas, they took that half-baked message and then they made the conspiracy. In UK, recently we had Royal College of Obstetrician and Gynecology. Their president has made a clear statement that for both females and men, this vaccine has nothing to do with fertility. It doesn't affect fertility. So be confident. If you're at the moment, obviously, fertility is a young issue, and young people are not being invited unless you suffer from significant medical problems. But when your turn comes, please do go. It has nothing to do with fertility.
Okay, good. Perhaps, Stephen, Councillor Craddock, we can ask the Director of Public Health, and through your portfolio, to issue some kind of a clarification message along the lines that Dr. Adeel has said, that there is absolutely no truth that the vaccine causes fertility problem for women.
We're trying to do. We're always trying to improve Q&A sections on the council's website, and I'll see if I can get that particular element added to it if it's not already there. But I'll mention that to him. Thank you.
No, that's appreciated. A question for you, Councillor Craddock, from Taslim says, are there any plans for COVID testing centre in Palfrey, Karma, Pleck, Chuckry or Birchills?
That was a bit of a... So this is for COVID testing, not vaccinations.
I think that Taslim, if you can just clarify, do you mean testing, or do you mean...
Yes, testing. The question is about testing. Yeah, COVID testing centres.
Yeah.
No, I'm just trying to ask for clarification.
I don't think there are any more testing stations planned. We have pretty good coverage across the borough. I appreciate that some people may have to travel a little bit further than others. We're doing home testing at the moment in WS2. Whether that's a project that we may extend has yet to be decided. But at the moment, we're concentrating on the vaccination programme. Hopefully, the amount of testing will go down fairly soon, and that's the plan.
Dr. Adeel, there's a question from Sister Sadia, which is, are there any categories of health illnesses that will be exempt from the vaccine?
No, there are none, because these are not live virus vaccines. So there are certain vaccines which not the COVID vaccines. For certain people who are immunosuppressed, we don't give them live virus vaccines. But all these vaccines which have been approved, they're not live virus. So there's no health illness exemption as far as I'm aware. It's for everyone. However, just to point to something which a month back, a study came from Norway where they recommended people who are extremely elderly and vulnerable give the vaccine with care to them, because they're already so frail, terminally unwell. Even a minor side effect with these vaccines can cause like flu-like symptoms, might be serious for them. But generally, for most people, for most health, all health illnesses. There are no contraindications or exemptions. But again, speak to your own doctor, so they don't know your medical history better, and they'll be able to give you a better answer.
Okay. There's quite a few questions coming up. I think there might be a question to start with Councillor Craddock, which is, how did you find out the variant in WS2?
Right, WS2, there was a resident who tested positive on the 19th of December. At that point in time, he would have been and did isolate. We've done the track and trace. His partner didn't contract the South African variant, and we can't find any of his contacts that have contracted the South African variant. What happens with the positive tests? About 10%, between 5 and 10% are sent away to another place, and they are genome sequenced. I think that's the expression. I'm hoping the doctor's going to nod at me. Sequenced. So what they do there, they look at which particular variant is actually in circulation, and that takes about 5 to 6 weeks. So we found out as a council last Thursday. We were told in confidence because the news was embargoed until Monday lunchtime, when it was announced in the House of Commons by Matt Hancock. But over the weekend, we mobilised a large force of volunteers, council staff, etc. We organised 2 mobile testing units, which one is at Walsall College and one is at Forest Arts. And the plan is to test all 10,000 residents in that WS2 area. Now, we're hoping, I mean, if we didn't find a single one, that would be great. I think that's probably unlikely. I think we might find some others. But we do need to find out what the extent of the South African variant is. Now, we know that in South Africa, it has become the dominant strain. They haven't got the Kent virus over there. So we don't know whether the Kent virus or the South African virus is more dominant. And obviously, we know that the Kent virus is dominant in this country. So I think we're trying to establish, if it's in the community, how much of it is in the community. Obviously, if anybody tests positive from the current round of tests, they will be told to isolate. And any positive test, now, where we're doing asymptomatic testing, that's where there's no symptoms, so you're not suffering any of the normal side effects that you would have with COVID. And the one that particularly highlights it to younger people is the lack of smell and taste. My son-in-law and my daughter both have it, and the only reason they really knew is because they lost their sense of taste, and then they went off and got tested positive. So they didn't have any other effects. They felt a little bit off colour, but normally he would have gone to work feeling like that, but when he was tested positive, stayed at home. So, get back to my point. Out of the 10,000 tests, we'd normally, on some of the mass testing, we've seen 2% positive cases for COVID, and that represents about 200 tests. So those 200 tests will be fast-tracked, first of all, to tell you whether you've got COVID, and then all 200 will be sequenced to find out what the variant is. So we don't know at the moment. They started the door knocking today. They started on site yesterday because I was at Forest Arts and people were coming through the door. It's a drive-in or a walk-in without appointments. You just turn up and you get tested. But if you can't get out, then you can wait at home. Now, it applies to all adults in that area, but it also applies to people who work in the area on a regular basis. So those people need to get tested. And also, if you're in a bubble with somebody in the WS2 area and you're regularly bubbling with somebody there, then you should get tested too. And you'd have to go to one of the 2 sites, the mobile testing units at Walsall College or at Forest Arts to get the test. Obviously, we won't be knocking on your door probably because we're concentrating on the WS2 area. Hope that's clear, Chair.
That's great, thank you. We got 10 minutes. I just want to invite Imam Saeed to pass on a message in Urdu to everyone who's listening. And also, I want to bring Imad into, having heard what's been said from an Islamic perspective, pass on a message in English. Hafiz Saeed Saab, Hafiz Saeed Saab, उर्दू में जो है वो थोड़ा सा ये भी बता दें कि भाई मस्जिदें जो है पिछले 3-4 हफ्तों से जो है ये मैसेज डिले कर रही हैं, और इस्लामिक पर्सपेक्टिव से भी आप जो है वो बता दें कि भाई जो कुछ मैंने सुना है कि भाई इसमें तो कोई ऑब्जेक्शन वैक्सीनेशन का नहीं होना चाहिए।
बिस्मिल्लाहिर्रहमानिर्रहीम। दो तजावीज़ अभी मैंने देखी हैं यहाँ। एक तजवीज़ तो ये आ रही थी कि ये सेशन उर्दू में भी ऐसा रन करें ताकि एक वाइडर कम्युनिटी जो है वो भी इससे इस्तेफादा कर सके। तो इंशाल्लाह उस पे तो आरिफ साहब आप ही सोचेंगे और देखेंगे। लेकिन जो दूसरी एक सिस्टर ने सजेशन दी थी कि ये जो कुछ भी आज हमने यहाँ कहा है इसको वाइडली स्प्रेड किया जाए थ्रू हमारा जो फोरम्स हैं, स्पेशली जुमा का जो फोरम है, फ्राइडेज जो गैदरिंग्स होती हैं उसमें। तो मैं उन सिस्टर के लिए बिलखुसूस और जनरल पब्लिक के लिए बिलअमूम ये बता रहा हूँ कि अल्हम्दुलिल्लाह लास्ट 4 यानी फ्राइडेज आप कह लें कि 1 महीना पहले जनवरी के शुरू से अल्हम्दुलिल्लाह हम कंटिन्यूसली इस कैंपेन को लॉन्च किया हुआ है, और हमने बड़े वाइडली जो है वो लोगों को बड़ा आप कह लें कि लाउड एंड क्लियर इस चीज़ को हमने किया है, लोगों के जहनों में बात बिठाने की कोशिश की है कि ये इंतहाई ज़रूरी है। और इसके जो रिलीजियस पर्सपेक्टिव जो भी है, ज़ाहिर है वो कॉन्स्पिरेसी थ्योरीज जो डॉक्टर अदील ने जिक्र की हैं, जो इस हवाले से कन्फ्यूजन्स और मिस इन्फॉर्मेशन हैं, उनको भी हमने एड्रेस किया है और पब्लिक को इस हवाले से बिल्कुल क्लियरली बताया है कि यानी इसके हलाल हराम के हवाले से भी बड़ा क्लियरली बताया है। और अभी दोबारा ज़ाहिर डॉक्टर अदील ने भी उसको टच किया है, हम भी बार बार कह रहे हैं, और उसी के लिए हमने यहाँ यानी लोकल आप कह लें कि कौंसिल के साथ मिलकर ऐसा भी सेटअप करने की कोशिश की कि मस्जिद में कोई ऐसा सेटअप हो जाए कि जहाँ लोगों को आप वैक्सीन लगाएं, तो उससे थ्रू आउट एक जनरल जो कम्युनिटी में मैसेज जाएगा वो ये है कि इट इज सेफ और हलाल, और हर लिहाज से इसमें कोई ऐसा इशू नहीं है। So just to actually conclude, I said that sister actually forwarded this suggestion that it should be widely and very clearly and loudly said from the forum of the masjid, especially in Friday gatherings. So I have actually responded to that sister that by the grace of Allah subhanahu wa ta'ala, we have done this long ago. I mean, from last month, last 4 Fridays, we are propagating this message, and we are telling and educating the people and creating this awareness for the people that it is quite safe and also halal. And in like obviously people, the religious communities, they're always concerned about when this vaccination is developed and some gelatin or something like that. Obviously these are the conspiracy theories. So we have addressed them and we have made the mind of people that it is quite safe and it is halal and it is Sharia compliance. So no problem at all. So people are aware now, and awareness is also obviously spreading. And our community, I think a larger community is quite clear regarding all these issues now. Jazakumullah khair.
Thank you, Afsab. Imad, do you want to relay a message? Because you've been patiently listening with your experience.
Imad has lost connection.
Okay,
So,
okay, that's fine. We have 4 to 5 minutes. So, are there any last minutes?
Arif Saab, I would like to bring just one issue up. I was talking to some nurses, black and minority ethnic nurses from east of England today, and yesterday I was in a meeting with anti-Muslim hatred group, and there's something which is coming up again and again from BAM community in general, that when the vaccines are given, there's no ethnicity recorded there. So at the moment, we do not have accurate data that how many people are getting or not. Actually, in my own personal experience as a GP here in Walsall and in Birmingham, the uptake rate has been very, very good in the community. So most of the surveys which have been coming are actually the survey or polling rather than actual data. So what people from minority ethnic background, what the way they're feeling at the moment is that they've been put into spotlight again. And people don't like being put in the spotlight. We have been used to this in the past. And this type of attitude usually alienates the community further. So rather, we from the BIMA's forum, we're trying to change the narrative a bit to, if you give ethnic minority community a message that we all in this together, white, black, Asian, whatever your skin color, we all in this together, that would include more people into vaccination campaign rather than focusing on black and minority ethnic. The other aspect of this, which I've spoken to from BIMA's behalf, we've spoken to the various local MPs, they've written to Ministry of Interior as well. One needs to look where these conspiracy theories are actually coming from. Almost all of them come from the extreme far right element. And there's plenty written on this. Actually, there was a doctor who was very famous anti-vaxxer, got arrested in the Capitol riots recently. And police and obviously the relevant agencies are aware of that. And those same bodies, they are the first one to blame black and ethnic minority people that, oh, these people are the ones who are preventing us achieving herd immunity. So it's important for community to realize that it is our social responsibility. And like Imam said earlier, it's a religious responsibility to get vaccinated as well. And do not play in the hands of those people who want to harm you anyway. So we all in this together. So whatever the color of the skin, everyone's getting this vaccine, and we should be the first one in the queue to get this vaccine. So this is, I thought I'll just clarify this issue slightly.
No, that's appreciated, Dr. Adeel. And of course, this virus doesn't discriminate. Yeah, it passes on to whoever it likes, and BAME communities more vulnerable than the rest of the community. Stephen, do you want to pass on a final message? Because I think the questions, there'll be more questions, but I'm conscious of the time that we're approaching 9:30. So do you want to pass on a final message?
Yes. Obviously, I would encourage everybody to get the vaccination as soon as they possibly are offered it. It will be offered to you. You can't go and book yourself in. Obviously, it's going down the hierarchy of the age groups and clinically vulnerable, etc. There is probably going to be other questions that people would like answered by me or the council. I'm more than happy to respond to those, Chair. So either you can collate them or they can email me on my council address, which is on the councillor website at Walsall Council. So I would be happy to respond to those. Thank you, Chair.
Thanks very much, Steve. Just to say that through UMO, we've been working with our mosques, with Director of Public Health Stephen Gunter, trying to get this positive message put across to all the mosques. So in Walsall, we've started the education both to make sure that people are aware of coronavirus, to take steps and government guidelines seriously, particularly when they come to the mosque. And our 17 mosques have been upfront in terms of implementing guidelines and actually going beyond the guideline by implementing face masks even before they became compulsory. So it's credit to all the mosques and all the committee members who've been at the forefront trying to keep mosques open, but at the same time ensuring that the government guidelines are fully complied with. I just want to take the option. Imad, I saw you're back on. Imad, do you want to pass on a final message? I hope you've been listening to it, but here's an opportunity for you to pass on a final message.
Yeah, I think my internet connection on my laptop just broke, so I had to rejoin on my phone. Yeah, I just think that I'd just like to kind of really thank everyone who spoke and everyone who actually joined in, because by participating in such forums, we're actually helping, in more ways than we can imagine, in kind of spreading this positive information and empowering people to make an informed choice when it comes to their own kind of healthcare. And it's really important that we do clarify any sort of misconceptions that we have, because loads of questions were posed today that loads of people didn't have the answer to, but we did kind of have the answer to them, and we are going to have more questions in the future. So just keep your questions coming in, because we need clarification, and it enables us to be empowered to kind of make our healthcare choices. And finally, I'd just like to thank UMO for organizing this event, and I hope it's been beneficial, and just wants to thank the organizers. So thank you very much, Chair.
Okay, Imam, that's appreciated. I just want to pass on a message to Councillor Craddock and to Walsall Council. Public health obviously now comes under your portfolio, Councillor Craddock. So public health have been working quite closely with UMO. The message that we've been putting through in partnership through the mosque has been working. So if you can take on that message that we are open to work in partnership. The uptake in vaccination in Walsall is very good. It's thanks to people in British Islamic Medical Association, like Dr. Adeel. There are people in CCG. Aisha Mosque tomorrow will open its doors to vaccination, and there are other places of worship that are opening their doors to vaccination, and that is credit to CCG and Walsall Council and Public Health for listening to the community, for going out to the community, so that we can spread the message and we can work in partnership to make sure that we reach the hard-to-reach BAME community as well. So if you can take that message to Public Health and to the Council, that'd be really appreciated from the community.
Thank you, Chair.
Yeah. So I just want to thank our panel members, Hafiz Saeed from Aisha Mosque, Imam from Brighton, and this is the beauty of virtual technology. You can be anywhere and still join us in Walsall. So thank you very much indeed. And Cabinet Member Stephen Craddock, good friend from Brownhills. So thanks very much indeed for all the hard work that you are doing on behalf of the community. So thank you for joining us. And Dr. Adeel Riaz, I know Dr. Adeel has been really busy across the Midlands, participating and educating and working in the Pakistani community, trying to reach out. So Dr. Adeel Riaz, thanks very much indeed. And can I thank everyone who's joined us? There's been up to 50 people who have joined us today. So thank you very much indeed. And I will pick up the issue of doing a similar program in Urdu. I'll discuss it with the appropriate people and we'll set a program up. So everyone, thanks very much indeed, and good night. Good Hafiz.
Chair. Bye.
Thank you.